going to tell you about my degree's final thesis. First of all, subarachnoid hemorrhage is a rare type of stroke which can cause the death of the patient and or permanent injuries. Because of this project aims to create a super tool that can be useful for the medical staff of the ICU by predicting the prognosis of patients. First of all, we did a universe analysis with the data provided by the Hospital Clínic de Barcelona that had a total of 130 patients and 133 variables. Most of these variables weren't useful for this project, and we did a data cleaning with an expert, a medical expert. After this, the database was of 130 patients and 39 variables. With this database, with a demographic table where we use the p-value to evaluate the correlation of the outcome with the variables. The ranking count reflects the neurological prognostic 3 months after the stroke. After this, we can see that the variable mb.date that has no relationship between with the outcome ranking cut in terms of p-value is going to be useful for evaluate the effect of mechanical ventilation later on this project. Later, we did the correlation matrix with the p-value to validate the previous results and also to delete variables that were highly correlated. This happens with variables like DBA and hidrocefalia ingreso. We're going to use DBA because it's also more correlated with ranking cut. Last, we did the distribution analysis. First, we did with the numerical, binary, categorical, etc. variables, and we can see that any of the variables has a clear difference between the classes good and poor of the outcome. They are highly overlapped. With this, we can conclude that we can use machine learning to create a model that can predict the outcome. We did an imputation with the missing data after this, a multiple imputation. We combine all the new values by the median technique, median statistic, and we obtain a complete database that we use to multivariate analysis. We split the data in training and test, and we select the predictor by 5 criteria, 2 medical and 3 with machine learning algorithms. After this, we select 5 algorithms, we select the best hyperparameters, and we train and use cross-validation on these models, and we obtain that the sensitivity is very low. Because of this, we resample the models with bootstrapping. We double with the bootstrapping the good, that was only 30.7% of the patients, and we obtain an equal number of patients of the 2 classes. We retrain the model. We did this repeat cross-validation of 10 partitions and 50 repetitions, and we retrain the models, and we obtain a high sensitivity but lower specificity. In order to increase the sensitivity without improving the sensitivity, specificity and accuracy, we use an ensemble training model that combines 4 of the 5 algorithms that we used before. We didn't use LDA because it's similar to logistic regression, and we also use the medical and IC because the predictors are more representative from the medical point of view. We test the models with test data. We did the ROC curve that were very close to 1, and it is very uncommon to predict the outcome of a patient at day 0. This is because of this project makes more sense as the days pass by. We used only patients that are 3 or more days intubated with the mb.days, because this table increases the number of these patients with good prognostic. We reframe the models, and we test the models. We obtain these ROC curves, and we can conclude that the models can be useful to create a super tool for the medical staff at day 0, and they can be useful as the days pass by and can be transferred to other diseases.